This segment of The Exchange on My West Michigan is sponsored by iChiro Clinics. Anyone who lives with chronic pain understands completely the desire to do something, often anything, to get that pain to go away. But masking pain isn't fixing anything. Here to talk about another option is Dr. Michael Kwast from iChiro. Good morning. Good to have you here.
Good morning. Thank you.
Yeah, masking pain, we say, I think culturally we want to just take a pill, right? I mean, that's just sort of the way that people deal with pain. Too often and to not very good outcomes, right?
Yeah, it's really kind of sad. I mean, when you look at even just the data that's out right now that we have from the government, it shows that so many people die from prescription drugs. And while we need prescription drugs for certain things, many people are abusing it by thinking that they're actually fixing something by covering up how they feel. And it's understandable, like you said, because to try to fix a lot of problems, my shoulder, my back, my neck, I mean, that's going to take some work.
Yeah, and sometimes you just want to muscle through it.
Yeah.
But the problem with taking something that masks the pain, then you could further injure, right? Because you don't think you feel it, but you're actually still putting stress on an injury.
Yeah, exactly, and that's what we see like way too often, where you'll see somebody think they're fine because they've got 12 Tylenol in their system, and then they'll go lift and bend, and they actually make the problem worse and worse and worse, and then they need more and more and more pills.
Yeah.
And so really it's better not only to avoid the risk of getting dependent on more drugs, but just Tylenol alone is the #1 cause of acute liver failure in the U.S. People don't know, and so the acetaminophen. So people who are taking lots of things really should start to look at other options and opportunities, you know, like what we do to try to help them function better and actually get to the cause of the muscle imbalances that are causing their pains, whether it's back pain, neck pain, headaches, you know, knee pain, shoulder pain. What I find is people just don't even know that what we do is an option for them. They're just completely ignorant on the things that could be done to help them.
Yeah, so when somebody comes to you, you know, presenting with a pain of some sort, how do you get to the bottom of it so that what you do is effective?
Sure. What we do, the first step is to do an evaluation. So we would go through and test the person's body physically. So we would move the joints, see what your range of motion is, see where the muscle knots are, do orthopedic tests to challenge the joints. And once you get that picture, you have a really good idea what's going on as a physician. Once we see that, then we also have a baseline where we can then do treatments and then redo those tests again to actually see what kind of changes have happened and are we moving in the right direction? And that is really unheard of. Most people, when they think of, you know, chiropractic, they just think you just go in when you hurt and magically it's fixed in a visit. And that's very, very rare. That can happen, but it's very rare. Most people with chronic problems, it's going to take time and effort to change all those muscles.
Yeah.
But it restores their mobility, restores their function, then reduces their needs of medication and gives you a better quality of life. And who wouldn't want that?
Yeah, of course. So you can deal with pain that comes from injury, but also that chronic, that long-term pain that may come from an arthritis or something like that.
Sure. And a lot of those problems are actually caused from having an unaddressed problem that's been sitting there for too long. It's problems like that that actually develop over time.
Well, we got to let you know, if you want to contact Dr. Kwast to talk about your own situation, we've put his contact information on our website. It's at WZZM13.com under The Exchange. Dr. Kwast, thanks for being here.
Thank you.
And thanks to you for watching. Make it a great afternoon.